So this is incorporated with all accreditation service. So this is the work of Dr. Orapan from CDC of Thailand to mention about occupational health, health and safety, but mainly they focus on service, as I mentioned you before. Why? Because the Ministry of Public Health haven't made any organization at the up level about this part, and should be in the workforce part, okay? Right, I just have to jump a little bit. I think it's the same problem. What's the problem with healthcare workers? So mostly identified from biomechanics, right? Back age, and yes, a kind of, and bio, like all the organisms, microbiology things, and a little bit of physical, needle injuries and musculoskeletal, and pulmonary tuberculosis and stress is part of the problem. So the law actually had pushed us to get faster, and also with, like today, hospital accreditation had put on this update version, and specifically in 1/5 in 5.1c mentioned about workplace and workforce that hospitals had to take care, but the detail is actually described here on the number C's in how to do the health, like clinical assessment. But I think the B1 and the C1 also need to expand on to describe the workplace safety, and I'll show you later. Like actually, the standard we use, like occupational and safety standard, or we come across this one. When I talk to my boss about it, many regulations we have to follow. But I said, yes, anything to work with healthcare worker and our staff, but not just like any ordinary thing. We have to put things to really meet the standard, not just anything, right? Standard to support the work processes a lot. Especially I use like OSHA, NIOSH. During the COVID-19, I was also responsible for, up to now, actually I am, right, work with the COVID of healthcare worker. I took care, and we have very minimal percentage of healthcare work, our hospital worker to get occupational COVID-19 because of we put a standard of NIOSH standard of PPE. We have to stick to standard. And all the things with health and safety for healthcare workers should be under the outline of the concept hierarchy of hazard control. It's the same thing with the factories, but most of biological hazard, we need a good PPE and injury control system to, in order to protect our worker from the contracted diseases. And also chemical substances and radiation is serious hazards. I taught my medical student from 4th year, 5th year, and then I took them to visit factories and hospitals. I asked them at the end of the courses, what did you think about the hazard in the workplace? Which one that did you feel so hazardous in the workplace between industry and hospital? All of them said, hospital. Interesting. Because people have thought that factories workers have more hazard. But once we look out and not really get it controlled properly and ignore any standard or the law, that would get the hospital more hazardous than in the other factories. This is a kind of component, and I think all of you know this all. We have to follow basic occupational health service for workforce, which is like to check fit for work, or any kind of program for medical surveillance. And also, when people exposes to the TB, we have to do post-exposure. We have bring it up to the CDC standard. We did the big ECRI tests, I think the biggest in Thailand in my hospital. And then we control the TB. We have only one or two cases, never more than it, for work-related TB in our hospital because of the screening, catching up the surveillance program. So this is a kind of standard we use, and we focus on personal safety. About occupational health and safety, we'll concentrate on infection and exposure and the process of work and hazard and try to control. And also E, working conditions is like a kind of factors that create well-being, right? Number of hours of work. So working condition and working environment are not the same, actually, but people get confused. Even our law used wrong, I think, English to describe that law. Okay, this is right. We also not link on the HRM like a risk management report to link with the occupational health and safety ARS, as you know, and I put the level whether which injury should report, like beyond the first aid level. So you shouldn't report anything, but in contrast, Thailand law asks us, enforce us to report any injury, everything. But they classify not in the international standard like we know. First aid and beyond first aid, right? They use the number of days of leaving the work, like 3 days or more than 3 days, and the severity, and got confused to me. Otherwise, we have to report every cases, which is not really, it's like the way it's too much, right? Yeah, right. Okay. I don't know how to do that because now our hospital was asked, why you report a lot of little injury to the Ministry of Labor? I need to talk to you, to ask us to lower down the number to report all these things. So this is a kind of framework for basic occupational health. Like what I'm trying to tell our Thai people that to take care of health workers is not just to do the annual health checkup or just the cholesterol, LDL. There are so many things at the beginning of the work, whether they're fitted to work, whether they have to have the program for medical surveillance, whether they have to change the work, modify the work after they have the health problem. So, or if we have to link for the workplace, we have to change all the workplace a little bit. And also, even they have the problem with the work-related, we need to have the benefits. Now we have big 3 benefits for healthcare worker. Benefits mean like compensation, right? Right? One is workman compensation scheme. Second, from universal coverage policy, more 18, more 18. And the other is from Act of Government Compensation 2561อะไรนะค่ะ all these three fundings for Thailand. And now I take up many cases to workmen compensation these days more than in the past, and they realize that. So to do that framework, it took me 2-3 days to come up. Not easy because you have to have approach. My approach with my healthcare work is that I have to ask first whether they suffer from the patient who are under the UC, universal coverage policy. If yes, we have to follow universal coverage policy. If not, we go for workmen compensation or other funding. So it takes me some time to get this ก็หลายๆคนอาจจะไปใช้ได้นะคะ Thailand right to take up เพราะว่าใช้เวลานานมากกว่าจะได้แต่อันนี้ไม่ต้องคิดแล้วนะคะคิดทำแล้วได้sudden นะคะใช้ได้เลย abrupt onset sorry ค่ะเมื่อยค่ะพูดภาษาอังกฤษมากค่ะ this is a national policy right I have to run a little bit this is kind of that and also about this is my expert too working with national rubber latex allergy. What I like to tell you, our country does not high like Europe to get latex allergy, but Europe has declined because they don't use natural rubber latex anymore, right? But in Asian country, we still use that gloves. But what I studied up to now, our new finding discovered that if you buy the glove for workers, natural rubber latex glove for our health personnel, you should to keep as low as possible of extractable protein. I now check the protein of our gloves and feel like our hospital have used the glove nearly 30 microgram per decimeter, whereas the ASTM standard has a limit like 200, right, microgram per decimeter of the piece of the globes. It means that as low as now we have only 5 cases of immediate type hypersensitivity, and we change the globe to get better. So this is a kind of how to manage, like I mentioned to everyone. So to work with healthcare workers, not just making the curative activity for them. There's so many work to do, especially with administrative work. I think I should connect with the last speaker that they try to emphasize that doctors and nurses should work and focus on administrative as well as their professional work as well. Why? Because management and administrative work would also bring up the good quality of the patient care service as well. Not only working with individual patients, so we work with the healthcare worker, we have to work with like the community. So we need the system to help, not only the professional knowledge. This is how I work about my TB work. So when we did the study, we used only routine work and try to describe what the data like in, and then telling you to change the work system. And there's a shift work. This shift work also telling us that shift work with the backward shift has made the poor quality of sleeping. So nearly final, one of other work, like I'm quite happy that when we measure about indicator for occupational health and safety work implementation, many would focus on the lacking indicators, like the number of injuries of work-related. But what I like to discuss a little bit more, if we can measure, this is a kind of our work, quality of work life instead as a leading indicator, and also measure the process of processing which we implemented to healthcare worker right at the beginning from the policies, planning, worker involvement, right, and quality improvement, evaluation on this kind of thing would be more benefits than only measuring the lacking indicator, which we really can make up our data. If you want 0 TB, you just say 0, right? It's easy. If we measure only that and we feel better with the final number, I think we mark the same thing and we cannot really solve the problem correctly. So in Thailand, I translate quality of work life. This quote is only first I think in the world now, has been used and complies with 7 dimensions. Thai has one already in the link, and Indonesian one is coming up because my student from Indonesia has done this work, validated thesis, and been quite used nationwide now. So quality of work life is to measure those dimensions. It's a field question, and it tests many countries from Professor Vala, including Thailand, China, Indonesia now, right, in this part of the world. And anyone, you can go to this website and get this copy and really request to ask for the permissions as well from our team. My conclusion is that Thailand needs to get the system only. I think the people to work for healthcare workers is already exist in the country. But the system, formal system, under recognition of the executive level of the hospital, maybe it's a priority this day. And I should have the time later to talk, if possible, about how we handle COVID with our professionals. Thank you so much for listening.